One of the most important factors in determining whether a patient's treatment is effective is social support. Relationships with family, friends, and even acquaintances can have positive effects on physical and mental health. Thus, it's important in looking at healthcare to look at the different types of social supports that are available and sometimes unavailable to patients, and the positive and sometimes negative functions of each kind. So, one way we can look at this is instrumental support. Instrumental support are tangible types of assistance: money, help with a project, meals, or transportation when someone's ill. There are obvious positives to this. Help can be crucial. If you're unable to manage on your own, these kinds of supports can make the difference of survival. But there are negatives as well. Sometimes it can feel patronizing, or can undermine people's ability to succeed. It can feel infantilizing and move to kind of learned helplessness. Another type of support is informational support. This can be information about an illness or treatment that you receive from friends or support groups or caregivers. Now, there are real positives to this. Information can give people a feeling of more control. They can use this information to become educated about their illness and about their care. So, information can be great when you get this from people, but there are negatives as well. It can be unwanted, sometimes inappropriate, and it can feel like unwanted advice. It can also be overwhelming and make patients worry. And this is if actually the information you receive is correct. I'm sure you've had experiences of relatives sending you information, blockbuster information about health that, a quick check on Snopes will tell you really isn't accurate. Um, we can also talk about emotional support. This can be the simple act of listening to a person's concerns and troubles, validating them and offering encouragement, just being there. There's some clear positives. Um, Mostly people respond positively to emotional support, much more so than informational support. It helps people deal with stress and the distress of illness. But emotional support can be difficult to pull off for some people. And when it's done ineffectively, there are real negatives. So it can feel like a partner or a friend is trying to solve a problem and isn't listening, or it can feel like the situation is being minimized in order for you to feel better. So we really have to think about that. Now, there's another type of support, which is esteem or appraisal support. And this helps people who are dealing with illness and stress feel validated um, and that their problems are legitimate. It's, of course, associated with emotional support, but it's kind of taken to that next step. Some clear positives here. Esteem support is especially helpful with people who are suffering from illnesses which face social stigma, like mental illness or HIV, AIDS, eating disorders. Esteem support can improve feelings of self worth and diminish isolation and depression. But just like emotional support, esteem support can be hard to pull off. Not everyone views the situation as a legitimate problem, or they might view the individual as partly or mostly to blame for the situation. And as such, the provider of the STEAM support might not be the ideal person to give it. So, this is why members of support groups are often better able to provide support than family members or friends, even healthcare providers themselves.